President Trump takes to Twitter Wednesday, criticizing the Affordable Care Act and promising a broad set of proposals to prevent the Affordable Care Act's exchanges from collapsing before Republicans can come up with a replacement. Joining us to discuss is WSJ Health and Science Bureau Chief Stefanie Ilgenfritz. Stefanie, thanks so much for being with us. So Trump's reaction comes after Humana has declared that it's pulling out of the ACA. Is that right?
Humana did say, which is one of the major insurers in the country, did say yesterday that they were going to pull out for 2018.
Right.
It's the first major insurer to do so.
So it's having problems with it's been having problems with the individual market for a while, correct?
Yeah, as have many of the insurers. While overall the insurers for the most part are profitable, the individual market is a relatively small part of their businesses. They are experiencing losses in the individual market and have pulled out of many states in many cases. Humana is the first one to pull out entirely for 2018 from all of the states where it had individual plans. Now,
there also are some new proposed changes coming out of the Trump administration, which had been in the works before this announcement. What are some of those proposals?
There are a number of them. Some of them are designed to prevent people from buying insurance only when they're sick, which is one of the major complaints that the insurance industry has, that people it's too easy to buy plans outside of the open enrollment period.
Right. So they're making the enrollment period
shorter. So the enrollment period is shorter now, and they also have proposed some new restrictions on to make it not as easy to sign up in what are called special enrollment periods outside of that period.
Right. Now, does this do enough to address the central problem for insurers, which is that in the individual market, not enough healthy people are signing up?
Well, that is actually one of the things that this is meant to address. Whether it satisfies the insurers, we'll eventually find out. They're watching this very closely.
Right.
But the idea is to prevent people from buying insurance only when they're sick, so that if you have to get everybody has to buy insurance in this one particular enrollment period, then people will buy it even when they're healthy, because otherwise they wouldn't be able to.
Now, how worried are GOP lawmakers that other insurers might follow Humana's lead, and that would lead to millions of Americans suddenly being uninsured, and that could perhaps lead to a backlash in November?
I think that is generally a big concern in Washington and around the country, because a number of them have already begun to pull out. Mm-hmm. And if we eventually get to a place where we don't have anybody offering a plan in the individual market in some areas, it would be a big problem for people in that area. So that's one of the reasons that the emphasis right now is on trying to shore up the exchanges in the medium term until they can come up with a longer term plan.
Right. Well, what are some of the other insurers, like Anthem and Cigna? What are they saying? I mean, insurers are becoming increasingly vocal about their demands, aren't they?
Yes, and Aetna, for instance, had pulled out of several states and has just said today that they're watching this very, very closely to see if this is going to satisfy them. They don't feel they have enough information yet to make any decision about 2018.
And we should know more by the late spring, certainly by the early fall, correct, about what these other insurers' plans are?
Yes, but by this spring, the insurers are going to have to put in their proposals for the rates that they would charge for 2018 and indicate where they're going to be participating in the market.
Right.
They could still change their mind before everything is finalized in the fall, but we'll get some pretty strong signals this spring of who will participate and where.
Right. Now, does Humana's decision announced today have anything to do with the Valentine's Day breakup with Aetna? This is coming just a day after that.
I think it was just a coincidental timing, because the issue of whether or not they're going to participate in the exchanges has been going on for a long time.
Right.
It was a busy day for insurance.
Yes, it certainly was. And for you as well, Stefanie.
Very busy day.
Thank you so much for that.